Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Chitra Kiran with us. She, being a registered NHS healthcare worker in UK, is here to discuss about her journey, her struggles, what did she understand, how are the examinations there, how can you start with your first job, and so many things for all those dentists who want to settle down in UK and want to understand the healthcare system there. So welcome, Dr. Chitra, to the platform. It's really nice to have you here.
Thank you for having me here. Thank you.
So let's understand your journey. How did it start? How did you go to UK and how did it go till now?
I did my BDS in Bangalore, VS Dental College. That was in 2005. I finished my internship, and I worked for 5 years in India as a dentist there. And I got married to a GP in UK. That was in October 2010. Okay. So that's how I moved to UK. And when I moved to the UK, I had no intention of anything related to the dentistry. I just came to UK as a wife. And after coming here, I just relaxed myself for a few years and just got used to the cultural changes and the changes which was happening in my life. And that's it. And then once I realized that I cannot sit at home like this. It was quite boring without any friends, and it is a new place. So I wanted to do my exams. So that's how it started. And then I didn't have any support or anything. I didn't have any dental friends in the UK. My husband is a GP, so he had all the friends we had were about the doctors, but not the dentists. And I didn't have any dental friends to find out what is the exam and things like that. So we just found out that there is an exam called as an ORE, which I'm supposed to pass the two parts of exams, and I started trying for the exams.
Okay, great. So, and then I'm sure it went really well. You picked up your first job, and hence you are now practicing there.
So, yes, and now after passing I couldn't pass my ORE. I quit it in the in between. I passed my LDS. There's another part of it, another exams, which is equivalent to ORE. I passed LDS, and then I got my first job quite quickly.
Great. So now understanding, understanding your journey, all those students who want to come from India to UK, what are the possible routes for them, and is there any difference between an undergraduate or any, experienced BDS or an MDS on a next after 3-4 years experienced MDS? Is there any difference for them, to apply for and to come to UK?
So there are two ways of looking at it. One is we have to check about your visa status. That is the most hard part. The other one is about the exam itself. Okay, the visa part is one, you have to get a sponsorship visa. You come for a work as a work for the work. Yeah, you get a work permit and things like that. But the other way, where I came from, I didn't have any visa issues because I was married. I came with a spouse visa. Yeah, so it is much easier as a spouse visa because your visa doesn't depend on your work. Whereas when you come for the work, you have to have your work in place before you get a visa. So that I think it is much difficult. Yeah, and with the ORE itself, the exam itself, you have two types of exams which is conducted by the different bodies. One is the ORE, which is very famous and everybody knows about it. It's an overseas registration exam, which is conducted by the GDC itself. The GDC is where you have to get registered with to work as a dentist. So it is conducted by the GDC, whereas the other exam is called as a license in dental surgery. which is the LDS. It is conducted by the Royal College of Surgeons. So these two exams will enable you to get registered as a dentist in the UK. Okay, then coming on to your next question about experience wise and MDS. Yeah, so there is nothing, even if you have post graduation degree, you have to pass the ORE or LDS. There is no other route you can get registered with the General Dental Council, or else the other route is you have to do the BDS all over again in the UK. Again, as you know, the MDS is not recognized to get registered with the GDC, and there you start.
Okay. So just, that's, so actually we just lost you in middle. So if you can repeat it again.
Oh, sorry, where did I say? Sorry.
Just, after you have to do your BDS again.
Either you have to pass LDS ORE, or you have to do BDS in the UK, the whole of the course, which is not practical to do it. So that's why these are the two exams which will qualify you as a BDS graduate. So other than that, there is no other way of doing dentistry in the UK. That is the starting point.
Okay. Nice. So what I understand is everybody are on the same base. Everybody
Yes.
has to go through the same way.
Yes, there is no, even if you have experience or you do not have experience, the experience does matter. When you have started practicing already, it might come handy for you if you have done a master's in max fax. You might do the extractions, difficult extractions, much easier way. It will take less time to do once you start practicing. But there is no shortcut to enter into the register. You have to pass ORE or LDS.
Okay. So now understanding about ORE, what you mentioned, and you told that there are two parts. How is it different? And, if you can tell about your journey of passing ORE, how did you prepare and how did it go?
Yeah, well, I didn't pass ORE. I quit in between. Yeah. So, but I have taken up the exam before. So ORE has got two parts, ORE 1 and ORE 2. Okay. You have to pass both the parts to get registered as a dentist. Coming to ORE part 1, there are two papers in ORE part 1, part 1A and part 1B. So these are the theoretical exams. So here the paper A, it is a clinically applied sciences. It's mainly anatomy, physiology, and all the clinical the basic sciences are involved in it. Okay, the clinical how it is clinically applied. That is the paper 1. A. Then paper 1B is mainly all the other subjects like clinical dentistry, which is prostho, ortho, and all the all the 8 subjects like periodontics, conservative dentistry, all these things, the clinical dentistry. So these are the theoretical theory that's the ORE part 1, and once you have to pass both the parts of it simultaneously, which is quite, I wouldn't consider it as much difficult. You have the reading list which is in the website. You can go through it. Unfortunately, there is no MCQs or any other way of studying it. You have to go through the reading list, which is the books which they have mentioned in the website. So you have to go through it and read, and that's how you pass the exam. And also it is illegal to discuss about the questions, what could come on the GDC. And it's illegal to discuss about the questions which has come in the past as well.
Okay. So now, because you passed the part 1 examination, what I know. So how did you prepare for that? And, and how is the part 2?
Well, as I said, I had no contact with any of the dentists when I came here. So I tried my best to find a friend who is a dentist and who can guide me. But unfortunately, I didn't have at the time. So I just started studying from the website. I took up the books and I started studying straight away from the books. There is nothing, it's a lots to read. I just read and made a notes about it. I didn't have a question paper or anything at the time. And then luckily what happened was one week just before the exams, I just happened to meet one of my husband's friend's wife who also just cleared her ORE. So she told me to join one of the groups, which was at the time it was available, but now I don't think it is allowed anymore. So she asked me to join that group. Then I joined the group. To join the group as well, you have to produce all the certificates and stuff like that. You have to show that you are an authentic person and you are taking up ORE. That's why you are joining the group. So it was just 1 week before my exam. So it took 2 days for me to produce all the certificates for them, and then was the last 3 days. Then I got to know some of the questions which might appear on the exams. So I had to go through all the questions which was there in that group. There was a file section where I had to look for all the questions, and I tried to do only those questions for the last 3 days because
Facebook group.
that's
So it was a
sorry.
Facebook group. So it was a Facebook
It
group.
was a mutual support group. It was called as a ORE mutual support group. Um, um, it was, I think it was a group, but it doesn't exist because the GDC came to know about this group and they had to threaten them to close it. So, yeah, as per the rules, it is illegal to discuss any questions or which appears on GDC or the other exam as well.
Okay.
So luckily I got to know about some of this, and some of the questions repeated in the exams as well when I went, and I passed the exam quite because it requires you. Only thing what you do is if you are preparing for any other exams in India like MDS entrance exams, I am sure that you have come across these questions are relatively easier compared to these Indian exams. There is nothing like a ranking system, isn't it? It's like 50% you pass, 50% of the questions you pass, and you pass the exam. So I would consider it is relatively easier.
Okay. So now when it comes to part two, which
Yeah.
is comparatively difficult for especially Indian students because of the practical knowledge.
Yeah.
So how do how did you go through, and do you think it is a doable examination? So this is a question for Dr. Vandana. So she asked me that, is ORE part 2 very, very difficult or is it doable?
ORE part 2 is doable. Doable. There are so many people who have passed in the first attempt, so they are not anything different from us. So they also had, I know personally, some of them, they are nothing different from us, to be honest. But the thing is, how you prepare for the exam and how you do it on the day of the exam. How much ever you prepare for the exam, it's on the day what you do is what matters. Because it is all pressure. If you go by the Indian way of teaching and how we study for the Indian exams, it's more about the theoretical. We are very good at about theories, and we don't know how actually we treat the uh, person or a case. Whereas we can accept that practically, how we deal with the patient is much different from how we deal with the patient in the UK. So what they are testing here is they are trying to make you a safer dentist for the patient as well as for yourself. Okay. So that is what they are testing in this exam. If you are safe on both the sides, if the patient is safe having you as a dentist, and also you are a safe dentist. You don't get any don't get sued by what you're talking about. So in that case, you are a safe dentist. So that is what they are testing in the whole exam process. Okay, so if you are making answering the questions of the patient, you shouldn't go away from what it is in the textbook. At the same time, the patient should understand what you're trying to say, and he should be convinced with what you're trying to say, and how you present yourself, and how you don't get into the conflict by explaining what it is, any of the guidelines for that matter. Okay, so that is what they are testing in this exam.
Okay.
They don't want to know that you are a very brainy person or something like that. They don't want to know the theoretical part of you, how much you know about this. They just want to know how you're managing the patient. Okay, that is what the ORE is about. Part 2 is about. So coming to ORE part 2, so I took up my exam very quickly. I admit that it was my greatest mistake of my life, where I was not really prepared for it, for the attempt, for the first attempt. I booked my exams, and then I started studying for it. I preparing for it, although I didn't have resources, or I had not attended the courses when I took the exams. So I just it was too much of a pressure for me, because I had to, the exam dates open just 2 months before the exams, and I have booked the exam, whereas I have not applied for the course, or I don't know how the exam is. So that's how I would admit that it was my mistake. Then I took up another attempt as well, where I prepared. I believe that I prepared really well for the exam, and I knew what was how I need to deal with this. But then because at the time it was only 18% pass rate. There are 100 people attending these exams, and to pass only 18 people pass the whole exam. It was tough at the time, yeah. But I just failed at history taking of the treatment planning, where I had passed all the other parts, where OSCE, all the stations. Well, I passed the whole of the OSCEs. I passed the medical emergencies and treatment planning. Only for the case history taking I had failed, and the mannequin, everything I had passed, but just the treatment planning. In that treatment planning, I had failed the history taking part of it. So they can fail you in that section as well. So till then, I was not even aware that you can fail in history taking and pass the rest of the treatment planning. So that was a bit unlucky. I think that I was a bit unlucky at the time, because I had prepared well, I had given the exam well. I was hoping for a positive result, but it didn't happen. It was very disappointing at the time. And then I went back to one of my friends. At the time, we had a Facebook group at the time, and I got to know that he had recently passed the exam, and he was living somewhere close by where I am. So I just got in touch with him, and then he had passed the LDS.
Okay.
So he is the first person to tell me how to, to suggest me to go for LDS at the same time as ORE. Till then, I had no clue about LDS. I didn't know there was another exam which was going on, LDS. And also there were no exams going on when I was taking up my ORE part 1 and part 2 for the first 2 attempts. There were no LDS exam. LDS exam was not happening at the time for, I don't know, for a few years. Then after the few years, they again started with LDS.
Okay. So what exactly is LDS? This is something actually which is not talked about. It's more about ORE. So what is exactly is LDS? Does it go in the examination?
LDS is a license in dental surgery. It is the similar exam to ORE, but it is the conducting body is different, which is the Royal College of Surgeons. But it is doesn't matter, as long as you get registered by the GDC as a dentist, whichever exam, it doesn't matter. This in LDS. LDS is a similar sort of exams like ORE. It also has got the similar part 1 and part 2. LDS part 1 again has got two theory papers, that is A and B. And the ORE part 2 again has got three, instead of 4, they have 3 papers, 3 sections, which is a mannequin and treatment planning and OSCE. But the difference is in the OSCE, you get the medical emergencies. There are certain medical emergency cases that in OSCE, but you have to pass these medical emergency stations separately to pass the whole of the OSCEs. That is what is different from ORE. ORE has a medical emergency separate paper. Even if you fail just medical emergency, you can still pass ORE and you can give a medical emergency in next attempt. But in RCS, the medical emergency, you have to pass all the three stations in OSCE separately compared to, and even if you fail one station, you can fail the whole exam.
Okay. So otherwise, what I understand, it's the theory of both, the theory and practical of both are approximately the same.
Yeah, it's a syllabus is wise, it's all the same. But in LDS, it is more clinically applied. The sciences are more given importance. Like I think they do not ask you about the anatomy questions. They might ask you about, they don't ask about it. There are certain anatomy they ask, like enamel dentin and pulp is also an anatomy. So they ask about these things which are relevant to the dentistry.
Okay.
And they will not ask you anything about the physiology, where how the kidney functions and all those things, which can appear in ORE, but whereas not in LDS, because it is not relevant to dentistry. It's only the relevant things. I think it makes more sense with the LDS exams.
Correct. So now, when you mention both have the same kind of preparation, so is it more relevant for the dentists who are applying for ORE to also apply for LDS? Do you think so?
Yeah, well, if somebody had suggested me at the time, I would have done both of them simultaneously, because you are you're reading all of that and studying and going for the courses for the similar same thing. So yeah, I would suggest anybody to go simultaneously.
So now, after clearing the LDS, the next thing is to start with your job. So how did it go? How did you get your first job? And especially NHS. Now, when you're working in NHS, how did you get into NHS? Is the system very difficult? So this is also one question that is asked by, one of the doctors, is getting into NHS difficult? How did you to acquire a job in NHS after qualifying ORE exam? Is it very difficult, or how did you do that? So just understanding how.
Okay, after you get registered with the GDC, okay, then you have to, there are 2 ways of practicing dentistry. One is private or NHS. Okay. So for private, you do not need any training or anything. You can just practice. If you get a job, which is quite rare, but if you get a job, you can do private dentistry straight away. Okay. After registering with the GDC. Whereas for NHS, to work as an NHS dentist, you need to go through about 12 months, 6 to 12 months of supervised training in a accredited practice with the accredited and approved mentorship. Okay, so this is in simple words, or how can I say, is there is some senior person who has worked in the NHS dentistry for a certain amount of time. He is going to observe, he or she is going to observe you and do necessary changes to your working pattern, so that to match with the NHS dentistry. And there is a set of outcomes which is set by the certain deaneries. They will set your deaneries. They will tell you what you are supposed to do, what are the things you need to submit every month for the next 12 months. You have to complete that and show it to the deanery, and then they will give you then you will pass out of that training. This training is called PLBE.
Yes.
So it is like a foundation training. It's like more like an internship, I can say, but it is more stricter. And somebody in the practice is going to observe you, what you're doing, help you and guide you, and you have some tutorials. It's basically like a training, any of the other trainings.
So now when you mentioned that, private practice can start immediately after passing your LDS or ORE. And this is something that you have to have a mentor and, get guided. So is it difficult to find a mentor and, have a system where somebody guides you? How does it go? Why do everybody do not get into this?
Well, for the private dentistry, you do not have to have any mentorship. Yes,
NHS.
It's only
NHS.
It's only for NHS. So yes, it is quite hard to find a job. One is because you have no point, no reference where you can prove that how good you are with your work, because you have not worked in the UK, I can say. Yeah, even though you might have worked in the other countries, but not in the UK, so they don't know you very well about your work. Okay, so somebody is taking the responsibility of you to not to do any major mistakes with the patients. So that is basically a mentoring. Okay, so why will somebody take a responsibility of you unless and until they have an advantage from you? Yeah, that's the basic question. So one is they might take the advantage is one, they might tie you with the contract for like 2 or 3 years or maybe 5 years, and keep you in their practice, paying you less. And they have the reason you take up this job, you will be knowing this contract, you will be going through the contract, you will sign the contract, but because you are so desperate to get this first job, which is quite difficult, so they are doing the mentoring for you. Yeah, so you will go ahead with the job agreement, and they will tie you up for 3 years or 2 years, whatever it is. So that way it's difficult. The second way of how I got was with the major corporate firm. I got it quite quickly. I don't know how, but I just went for all the interviews and stuff. Some of them, some of them were not. There were one of the practices where I was ready to work voluntarily because it was so difficult to get the job, and I have been attending the interviews and coming back home, I get an email saying that somebody else have been appointed because of I don't know for what reason. Maybe I might not have sounded very confident there. So I would get an email saying that unfortunately we couldn't help you, or we will try to accommodate you when another jobs comes. Do it for free of cost. Like I don't take any salary or anything. I'll just do it for so that I finish my training.
Correct.
They were ready to do it, but then it's not about only the practice. With the deanery also has to agree that the practice is suitable for me, and the mentor is suitable for me to help me out. So the deanery rejected it, saying that the practice is not sufficient and it's not adequate for me to get trained there. So in the meantime, I got another corporate getting in touch with me, and I had attended few interviews and got rejected before. And then this one, the one which I got job, I attended the interview, and there were some agreements about we have to pay the mentor about £1,000 per month. From pre-tax. So for the next 12 months, I had to pay from my earnings. So that's how I took up that job, because it sounded a bit okay for me. because they were paying me normal amount, so I could pay the mentor. And so I took up that job and I finished my training there.
Okay. Okay. So now when now when you mentioned that because you joined the corporate and so there was no advantage on their end, they didn't sign any of your contract, or there was any advantage for the mentor?
Advantages of the mentor was I was paying the mentor, so that was £1,000 I was paying him for helping me out, and that was the advantage. Other than that, I didn't have any contract, like I didn't have to work in the same practice after my training. Yeah.
Okay. So now when you mention about, finding a job, and now after that you are an NHS certified dentist, isn't it?
Yes, I am working now as an NHS dentist. Now I have finished my training long ago. I'm just independent practitioner.
Okay. 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 Great. So now, so after clearing this, the NHS training, is it after that also you find it difficult to find a job, or is it fine after that? Then it's easy.
Once you finish your PLB, that's a foundation. First job is the way. First job as an NHS dentist, like to qualify as an NHS dentist, is I would. Even the private is quite difficult as well. The first job is difficult, I can say. But after that, yeah, it's not. They will find you, even if you do not want to work. They can find. They might find you, and they will ask you to work, because there are so much of deficiency of dentists in the UK at the moment.
Okay. So we have one question by Dr. Sasi Pradeep. He's asking that how to join in postgraduate OMFS in UK after BDS in India.
In the UK, to do OMFS, you have to do MBBS again. Yeah, there is no, the BDS qualification is not sufficient for doing OMFS. So you have to do MBBS again, and it's from the beginning.
Okay. Okay. So you need to have an MBBS degree for OMFS.
Yes.
Okay. So Dr. Pradeep, I hope you have got the answer. If any, please let us know. So now when what I understand that you are working in a countryside in UK.
Yeah.
So is it different because like in India, there is a difference in practices in the metros as well as in the, in the small cities. Is it the same with UK as well, or it's the same, with the pay and the work style? How does it go?
The NHS is same for the whole country. Like, yeah, I can say NHS is different in England, and the NHS is different in Scotland. In other places like Wales, I am not very sure. I don't have anybody there. And Northern Ireland as well, I don't have anybody there. I have no contact there. So I can just speak about in England and in Scotland. The Scotland NHS is quite different from NHS in England. So I'll just speak about NHS England because that is where I am working, and I know better about that. So the work-wise, the whole of the England is the same. NHS is the same wherever you work. That is one principle. It's there is some guidelines which is put forth by the NHS, and all of the dentists follow that guidelines. You cannot overrule that. You just have to follow the guidelines, and that is what is a safer way of doing it. The work-wise, it's all the same. If you're working in the cities, like cities, or in a more rich areas, like affluent areas, the possibility is that you may not how do I say, you may not have a lot of work to be done with the patient. Like they might come up with one caries, just do the filling, and you get paid for it. But whereas if you are in very poor areas, some of the areas are very down, so in that cases they neglect their oral health to a certain extent, where the person might come up with 10 caries lesions, at once. And then the payment wise, how the NHS payment work is, even if you do one filling and close the treatment, you are paid for the 3 UDAs.
Okay.
You are paid 3 UDAs even if you fill one cavity in one person, or 10 cavities in one person, you are paid again 3 UDAs. So that is a whole, again I have to have another discussion about UDA, how it works. It's a very long long thing. That is what you learn in 1 year of PLV, that is 1 year of training after exams. So it is not in the scope of, I cannot complete that. So easily I can say is, you one filling you do, you get paid that amount. 10 filling you do from that patient, you get paid the same amount. So whereas the time you use for one filling is much less compared to the time you use for 10 fillings. So that way you might be doing more money with the affluent rich areas, because you are treating just one filling and getting paid for it, whereas in the poor areas you will be working more harder to get paid for it. Okay, so it is not but the NHS system is the same all throughout the country. And whereas in some of the cities, maybe the people there are more corporate people, corporate who work for the corporates and things like that, so they might be more aesthetically present. They want looking good and all those things. So in that case, you might get more private cases in such places compared to the rural areas, where they are not bothered about how their teeth looks. They just want to their teeth for functional reasons. So they might not come for any of the aesthetic, like veneers or something like that. They may not come for it. In that case, you'll be making more money when you're in the cities. But it's pretty much the same, to be honest. Yeah, private dentistry may be a bit different in cities.
Okay. So nice to know about this. So we have some multiple questions for you. So
yeah.
Dr. Sridevia is asking, how can we do fellowship in UK? Do we need to register with the GDC or give exams for doing any fellowships?
So fellowships is that MFDS, is that one fellowship exam?
Fellowships are, so everywhere there are short fellowships going on. So, where in India there are 1 year, 2 year fellowships where they help you to understand about something or some research area, to understand about some research going on, so that you can assess them and understand about the system there. So is there any?
You can do these exams without registering with the GDC. However, these will not shorten your. It will not give you any permission to practice in the UK. You can do such courses like there are like MFDS, MRCS, or something of that sort. I have not done any of them because it is my aim was to get registered with the GDC. That's all. There was no other aim for me at the time. So I just did the exam, which enables me to work rather than any degrees.
Okay. So Dr. Shrikant is asking that, is it much easier for a GDC registered dental hygienist or dental therapist to get a job in NHS?
The dental hygienists, dental therapists, they have to go through a different course, and they are working as a private. They do not work as NHS. They are all private. We see the patient first. Point of contact is a dentist, and because we have so much of patients, like as I said, if the patient comes with 10 caries lesions, I cannot call the patient 10 times to do the fillings. What I do is I will refer the patient to the therapist, because she has a lot of time. She doesn't have a lot of time. They are all very busy, but the thing is, we distribute our time. Instead of seeing one patient 5 times for those 10 fillings, I would refer that patient to my therapist. She will be doing that 10 fillings for me, where I pay her her rate. Like I pay the hygienist for doing my work, so she is paid privately. She has a patient when I refer the patient to her or him, sorry, because my therapist is a lady, that's why I tell about she. Okay, so yeah, so they are all private, it's not NHS.
So they are not NHS. Okay.
Mhm.
So I hope Dr. Shrikant, your second question is also asked. So he asked, the second question was, do dental hygienists and therapists need to go for PLDE? That is the training.
Sorry.
So the second question that he asked was, whether the dental therapist also should go for the training. So maybe because they are not NHS registered, the PLB is not a question for them.
No, they are not NHS. They are not NHS in the first place. Secondly, they are not dentists. They are dental care professionals. They have a different course of, the way of entering into the field.
Okay. So Dr. Jessica is asking, how is the clinical practice different in UK as compared to India?
It is much different because it is NHS. NHS is basically government, yeah. So we do the treatment which is clinically required rather than cosmetic reasons. If the patient wants a veneer for his front tooth, I'm not able to give him a veneer because it is not covered under NHS. Okay, so there are certain things we are not allowed to do, and we cannot do it because it is not cost effective for me to do veneers. And secondly, if the patient comes for NHS denture, for example, upper and let's keep it as one upper denture, and he wants a crown on the lower tooth as well, so it will go on to the band 3 again. So it is not cost effective for me to do both of them in the same course of treatment. It will not work out for a dentist because you will be paid band 3 for this particular case, whereas you have to pay from your pay, you are supposed to pay the lab fees for both of them. So it doesn't work out really well. So you have to figure out what you can do and what you cannot do, and there are certain things certain things you cannot do under NHS. So it's if the patient is not qualified for NHS treatment, like as I said, in the veneers in the front tooth, if you want or maybe he needs a back tooth porcelain crown, in that case you can convert the similar case, the same case which has come for NHS into a private, and you can give a private crown on it if he is ready to pay for it.
Okay, so it's different. So because of the NHS,
it is quite different because we follow in the NHS in the UK. Basically, we follow all the guidelines which is put forth. So there are certain guidelines you have to follow, and that is the only way you can get sued. You can prevent yourself from getting sued, and you can prove that you are following all the things which are supposed to be followed.
Correct. So now Dr. Pradeep is again asking, he asked before about OMFS, PG. So he's again asking, as of India, OMFS is included in the dental PG program. Is it not included in UK dental program?
Well, after coming from the India, you can join as a I think there were some of the posts in the past where you join into OMFS and you assist the surgeon all the time, and that's I think it has got some name. I'm not very sure about the name at the moment. It was quite difficult to find that job, but even then you are not get registered as a dentist in the sorry, was there any break?
Yes. So we just lost you in the middle. So if you can repeat it, yes.
Okay. So in India, it is it's a dental program, but here in the UK, to do OMFS, it is you have to do MBBS, and you have to do uh, after that you have to do a post graduation. You have to work in the hospital setup. It is a completely different route. To be honest, it is not considered as a to be honest, it's considered as a dentistry. It is considered as a part of a medical field.
Mhm. Because maybe it's a surgeon job. It's a oral
Yeah,
medicine
it's a
surgeon.
surgeons. It is a completely different, completely different world where you work in general dental practice is a completely different world to for me. It's I hardly have seen any oral surgeon as such, because if there is any need for oral surgeon, we just do the referral and send a letter, and they will deal with the case, and they will communicate everything through the email or by the letters. I have hardly have any contact with any oral surgeon. I have not seen anybody as such. So
Okay.
it's a completely different world.
Okay. Okay. So, we have some questions so by Dr. Vandana as well. She's asking that as I want to, as I want to ask on site, it's mentioned that it's related to ORE. So on the website of the ORE, it's mentioned that 1600 hours of clinical work experience letters should not be old more than 3 months. So
Yeah.
my query is that the 3 months is counted from the day of exam date or from the day they receive our documents.
It is the day they receive their documents, because when they conduct the exams, we don't know when they conduct the exams. It's when you submit the documents. It shouldn't be more than 3 months.
Okay. Okay. She has one more question. She's asking that is the clinical work experience letter should be coming from the dean of our college, or is it okay from the clinician that she has worked clinically with?
It can be from both of them, but they are definitely going to contact whoever reference you have given. So that person should be available to answer their questions. There will be a one questionnaire sent to them, and they have to reply to their questionnaire, which is quite very easy, but they need an answer for them. Otherwise, your paperwork work might get stuck at that point.
Okay. Okay. And also she asked that when should she do the documentation for appearing in ORE Part 1?
As soon as all the documents are ready, your IELTS certificate is ready, and all the references are ready to, there are quite a lot to fill up in the application form. As soon as it's done, you can submit it. Once it is submitted, they have the GDC will accept, and you will get an email about they have received your documents, and they will check your documents. They will contact all the referees, like the dean, or the question which I had in the previously about the dean or a clinical practitioner. They will contact whoever's contact number or email IDs you have given. They will contact them. After they will expect the reply as well from them. And after all this is done, again you will receive an email that you are ready to apply for your exam
Okay.
when it opens.
So Dr. Jessica is asking, how long does it take to qualify ORE or LDS if you pass in first attempt?
Well, it can be as less as 6 months if you pass in both attempts first time.
Okay. Okay. So, nice to know about all of this. So how has, now I want to ask, how has your experience been working? Because you have worked in India as well. So how is your experience being working in UK? What are the good things and, some challenges on an everyday basis in your work?
Well, I'll tell about the good things first. One is you do not have to go to the practice at 6 o'clock in the evening. That is the best part in the UK, where you work like 9 to 5. You can choose your time. I have two kids, so I can't work full time. I have to be there for them to be cared. So I just work part time. Before I used to work, before having kids, I used to work full time. Then part time. It's all so you have a flexibility. That is what I mean to say. You have flexibility of working. You can choose your hours. You can choose working even on the weekends if you need more cash or something like that. You can work on weekends. Yeah, if you're working in NHS, you can also do private. If you need more income, you can also just take up more cases, more private cases. That way it's good. And yeah, you have a good work-life balance, work and home balance in the UK, I think. That is a good part of it. But the bad part, I mean, not so good is it's a lot the NHS is too much stressful. You see the patients every 10 minutes, every 10 minutes checkup. You do the checkup in 10 minutes, and you have to write down, note down everything what you see in that patient, and making the notes, and so that you don't get sued. And even if you get sued, you have enough of evidence to prove yourself that you have done everything right in that case. That way it's a bit of a pressure legally. Also when you're treating the patient, you have to always make sure that you have to be polite at the same time, and you have to finish the case within 10 minutes. So you can't look stressed, even though you are stressed. And you have to be calm at all the stages, with every single patient you see, and answer all of their questions with the same patience. Whereas you always have some stress going on in your mind. Maybe you are running late. The next patient may be waiting outside. There might be a lot of patients waiting outside, and it's just like too many cases. So you just see, I see from 9 to 5, I see as many as 30 patients a day. Yeah, so it is a bit stressful.
Okay. So Dr. Pradeep is asking, are there any ORE Part 2 coachings in UK?
ORE part in the UK, yes, there are plenty of them. And as soon as people pass out of ORE part 2, they think that they are quite qualified to take up a few courses. So they also start taking up. As you know, to get the first job, it is quite difficult. So in the meantime, what they try to do is to make some money by conducting these courses online. Maybe, the treatment planning and everything is it's just about speaking to the patient, so you can do it. Yeah, you have to be a bit careful. There are plenty of courses, and also the most good courses are quite expensive. They are quite expensive. What happens is, some people are, if they cannot afford, they might fall into these things, like they might take up some courses from the people who have just passed the exam. You just have to be a bit cautious about things like these. It can ruin your whole of the effort what you have done just by taking the courses from somebody who has just passed the exam. Just passing the exam doesn't mean that you are qualified enough to teach somebody else. Yeah. So you have to just think about which courses to go for. Definitely there are many courses which are available. One is in RCS itself, Royal College of Surgeons. They conduct the courses. They are pretty expensive, but they are quality assured. You know that these are the good courses. They cannot be wrong. Whatever they're teaching, they have to be right. Yeah, they are quality assured. You can attend those courses.
Okay, nice to know about this. So in the end, I will really ask some motivational words from your end for the students who want to clear the examinations and come to UK. So anything from your end that motivated you actually?
Yeah, well, once you are a dentist, you are a dentist. You cannot go back. After once you have gone through all of it, there is definitely light at the end of the tunnel. I'm happy at the place where I am now in terms of my career. Although I have not gone too far, but I'm satisfied with what I'm doing, and I'm happy with where I am. So I think, yeah, there is a good scope if you can
Yeah.
be persistent with your work.
Yes, yes, yes. So nice to know about your journey, Dr. Chitra, and to understand how are things in UK. How can people actually go through all the examinations and establish themselves? And hearing you, I completely understand that yes, there is a struggle, but because there is, as you added, there is light at the other end. It's all worth it. So
Yes,
doing all the hard work and putting in all the efforts is something which makes complete sense. And
yes.
thank you so much for discussing about your journey on the platform. We are really, very, very, grateful for that on our end. Thank you so much for
Thank you for having me here, and thank you for giving me this opportunity.
yes, thank you so much, Dr. Chitra, and thank you so much, everyone, for joining us at this time. I'm sure this session must have been helpful for each one of you to understand about UK, what all you can do, and how you can clear the different examinations and settle down there. What are the different routes? How is the scenario there? How are the clinical practices there? So if you're planning to go there, this session must have helped you a lot. Do share it with your friends and colleagues. I'm sure this will help them as well as motivate them to take wiser decisions, to move and to understand what they should do and not to do while they are going and settling down in UK. Also, do follow us on our Instagram as well as YouTube channels. There also you can find all our old videos which can also help with your career growth. Thank you so much, Dr. Chitra. Thank you so much,
You
everyone.
can share my phone number if
Yes,
at all anybody needs any questions, they can contact me.
sure. So yes, if anybody wants, I can definitely share, reach out to me. I will definitely share her contact details so that you can help, you can get the best help as from her as much as you can. Thank you so much, Dr. Chitra. Thank you so much, everyone.
Thank you.
Yeah,
Okay.
bye.
Thank you. Bye.
Bye, everyone. Good night, everyone in India. And actually, for you, it's good evening. Okay,
Yeah.
yeah. Okay, bye bye.
Good night.
Yeah.